You hear a presentation given by a senior healthcare professional about recognizing and managing sepsis. You have 90 seconds to read the questions. Good afternoon, everyone. Today, I want to discuss a critical and time-sensitive condition that all healthcare professionals must be able to recognize and manage effectively: sepsis. Sepsis is a life-threatening reaction to infection and is one of the leading causes of mortality in hospitals worldwide. Early detection and rapid intervention are key to improving patient outcomes. First, let's start with a basic definition. Sepsis occurs when the body's immune response to an infection becomes dysregulated, leading to widespread inflammation, tissue damage, and organ failure. It can be triggered by bacterial, viral, fungal, or parasitic infections. But bacterial infections, especially those of the lungs, urinary tract, abdomen, and bloodstream, are the most common culprits. Now, how do we recognize sepsis? The classic early signs include fever or hypothermia, tachycardia, tachypnea, altered mental status, and hypotension. Many of these signs overlap with other conditions, which is why sepsis can sometimes be missed in its early stages. The Quick Sequential Organ Failure Assessment, or QSOFA, is a useful bedside tool to identify high-risk patients. A QSOFA score of 2 or more, which includes low blood pressure, a respiratory rate of 22 breaths per minute or higher, or a Glasgow Coma Scale score below 15, suggests a higher likelihood of sepsis. As sepsis progresses, septic shock can develop. This is characterized by persistent hypotension despite fluid resuscitation and a high risk of multi-organ failure. Common complications include acute respiratory distress syndrome, kidney failure, and disseminated intravascular coagulation. If not treated promptly, septic shock carries a mortality rate of over 40%. So, how do we manage sepsis? The Sepsis 6 Bundle, a protocol developed to standardize early treatment, should be initiated within the first hour of recognizing sepsis. This includes administering high-flow oxygen if needed, obtaining blood cultures before starting antibiotics, administering broad-spectrum antibiotics within 1 hour, giving intravenous fluids to maintain perfusion, measuring serum lactate levels to assess tissue hypoxia, monitoring urine output to evaluate kidney function. Broad-spectrum antibiotics should be started as soon as possible, as each hour of delay in antibiotic administration increases mortality by around 8%. Once cultures return, antibiotics should be narrowed to target the identified pathogen. Fluid resuscitation is another critical step. A bolus of 30 ml per kg of crystalloid fluid is typically given. Care must be taken in patients with heart failure or kidney disease, as excessive fluids can worsen pulmonary edema. If a patient remains hypotensive after fluid administration, vasopressors, such as norepinephrine, should be initiated to maintain adequate blood pressure. In cases of severe sepsis or septic shock, admission to the intensive care unit is often necessary. Mechanical ventilation, renal replacement therapy, and even corticosteroids may be required in patients who are not responding to standard treatment. Finally, preventing sepsis is just as important as treating it. Proper hand hygiene, timely vaccination, and early treatment of infections can all help reduce the incidence of sepsis. Hospitalized patients, especially those with invasive devices like central lines, urinary catheters, or ventilators, require strict infection control measures to prevent nosocomial infections from developing into sepsis. To conclude, sepsis is a medical emergency that requires rapid recognition and aggressive treatment. By following the Sepsis 6 bundle, using early warning scores like QSOFA, and ensuring timely antibiotic administration, we can greatly improve patient survival. Thank you for your attention. I'll now take any questions you may have. You now have 90 seconds to complete your answers.